Dr. David Doherty, orthopedic surgeon with Memorial Hermann Joint Center. Welcome to the show. And what Courtney just said, why now? Like, why are there now more options than in the past for some of these candidates?
Well, I think some of this is multifactorial. We're seeing a huge volume of patients just based on age alone. People have degenerative joints that are causing pain and preventing them from getting the things done in life that they want to accomplish. And in the past several years, there have been dramatic increases in not only the technology of the implants, but also the procedures and the pain control methods in order for you to get through this procedure in a pretty pain-free way these days.
What I think is really great is so many people, my father-in-law included, has basically lived his life with bad knees and not doing the surgeries because they think, oh, downtime, and all of a sudden, you know, it's 25 years later and nothing's been done. And here's the solution. You don't need to live like that. You don't need to lose your mobility over this pain.
Right, and I think the concern in years past has been, what's the longevity of these procedures? Are they going to last 20 to 30 years and get you over the finish line, if you will? And what we've really been seeing in the past is that the younger patients, those under 50 or even those in their 40s, are really starting to do this procedure because we have had so many advances in the longevity. We're now expecting things to last at a minimum of 20 years, if not longer, particularly with the bearing surfaces we have now, and also just the techniques of putting them in that allow you to get that extra years on the end.
So, and that's a game changer for a lot of folks, whether they've had a traumatic injury or it's just pain from arthritis. Let's talk about the specifics about what a joint replacement actually entails. I know you have some visual aids here.
So we have some visual aids here. Hip and knee replacements essentially combine metal alloys, either titanium, cobalt chrome, with very hard and smooth plastics to get that natural joint motion back. And what you see here in this knee replacement specifically, it's more of a resurfacing procedure. We're not replacing the entire knee. We're resurfacing the parts that are worn out and that have lost their cartilage and are causing this disability, the pain of the bone-on-bone scraping.
Oh, yeah.
And with a hip replacement, as you can see here, only a little bit of it really shows at the end of the procedure because the rest of it is implanted into the bone so we can get a biologic fixation where the bone actually physically grows into these implants and creates that lifelong bond.
It's really fascinating. Let's talk about the benefits as far as the surgery. We're talking faster recovery time, of course, just quality of life in general. Sure. But why is the recovery time faster?
So the recovery time is quicker. We used to have people come into the hospital, spend 7 days or so laying on their back, not wanting to move their joint. It's the complete opposite now. We have them up and walking the same day as surgery, and that's all done under the supervision of a physical therapist who can ensure that they're doing the appropriate things. And what we found is that this early mobility, early motion leads to a quicker recovery. A little bit counterintuitive, but getting up and getting your motion back really does lead to much more success.
And I know you touched on this, Dr. Doherty, at the top of the segment, that if someone out there, maybe some of you watching right now, if you've been turned away from having this procedure in the past, now is the time to get a second opinion because, as you mentioned, things have come so far.
Things have really advanced, and we see a lot of patients in the Memorial Hermann Joint Center that have been told, you're either too young or your problem is too complex for us. And we pride ourselves on taking a good look and evaluating every patient that comes in the door, and oftentimes we can offer more than what they've been told in the past at other offices.
And this is a great place to be about the Memorial Hermann Joint Center because not only is it fabulous facility, but performing more than 3,000 joint replacement procedures each year. And by the way, you've got a local doctor back in Houston. You grew up here, right?
I grew up here. I love the city of Houston, and it's a true honor to come back and serve the community that I grew up in and I love so much. So it's a great facility. Not only is it a beautiful facility with huge patient rooms, all of the people that work there are hand-selected from other aspects of orthopedics to be brought into this team environment to ensure that we're doing everything possible. It's not just the surgery that leads to success, although all of our surgeons are subspecialized and trained specifically in these procedures. The nurses are also trained in them, the anesthesia doctors, and also, you know, everybody that you come into contact with has the shared goal of getting you up, getting you moving pain-free.
Well, Dr. Doherty, we are lucky to have you in our backyard. Yeah. People envy what we have here in
Right.
Houston, truly. So if you're having an issue, go see him. If you would like to schedule an appointment with a specialist at Memorial Hermann Joint Center, you can call 713-314-4444, or you can visit joint.memorialhermann.org.
And still ahead on today's show.